This week, we could see some of the biggest moves yet under Health Secretary Robert F. Kennedy Jr. to upend the vaccines we routinely get as kids. That's because an influential panel of vaccine advisors to the CDC, called the Advisory Committee on Immunization Practices, is set to meet Thursday and Friday. Now, they're scheduled to have a whole day of discussions about the entire vaccine schedule. That's the set of vaccines we get throughout childhood and adolescence to protect us against more than a dozen diseases. And they're set to vote on recommendations for hepatitis B shots, including potentially whether a dose should be given at birth. That's been a recommendation that's been in place in the U.S. for more than 30 years. Kennedy has advocated against getting so many vaccines for years, and in June, he replaced all the members of this committee with his own handpicked members, many who share his views. This group makes recommendations to the CDC director, which, if adopted, becomes CDC policy. Now, doctors don't necessarily have to follow the policies, but they can also influence whether insurance covers vaccines. This new group has had 2 meetings so far, and they've seriously alarmed public health experts by revisiting settled vaccine policy and putting an outsized emphasis on vaccine risks without considering their benefits, or, experts say, misinterpreting data completely. And the meeting comes after RFK Jr.'s vaccine chief at the FDA linked the COVID vaccine in an internal memo to deaths of at least 10 children, something outside experts say they can't evaluate without seeing the analyses. Now, the memo also promised sweeping changes to vaccine regulation more broadly, including how seasonal flu shots get approved and re-examining giving multiple vaccines at the same time. All of this is creating a lot of worry that important vaccines could become more expensive and harder to get, making what happens over the next couple days especially important for parents or parents-to-be to pay close attention to.